Welcome back to Wave Listens Live. Joining me now is Dr. Regan Ackerman, Freedom Mini Dental Implants, to tell us about their less invasive, small diameter mini implants. Dr. Ackerman, welcome to Listens Live.
Thanks for having me.
You know, a lot of people have seen you on the show before. They're probably at least a little bit familiar with what you do. But let's say, for the sake of today, they have never seen you before in their life. What are you telling them that you do?
Gotcha. So I do mini dental implants. Everybody's like, what's a mini dental implant? So it is a smaller diameter, less invasive implant. And a lot of times it's less healing time, and a lot of times can be a lot less costly than the surgical implant. So it's just a one-piece, small diameter titanium implant that can replace single teeth, multiple teeth, or help you secure your denture and make it a snap-in denture. If you're struggling with denture glue or floppy denture, we can snap that denture on to the mini dental implants. The great thing about the mini dental implant too is it being a lot less invasive. I don't have to have as much bone to place the implant, so people that were told they weren't a candidate for surgical implants can be a candidate for the mini implant. If you have periodontal disease, a lot of times I can still place the mini implant. And a lot of things too, people are worried about their medical conditions, if they're on blood thinners, things like that. It's so less invasive. I'm not making any incisions or stitches, so I don't have to take people off blood thinners. And actually, I have a model here that kind of just shows it beautifully, the difference and how less invasive they are. So when I place my mini dental implant, I'm numbing you out with local anesthetic. I do not have to sedate you. I am not making this big hole, okay? That is not the hole I make. I'm covering that one up because it's hard to even see, but this little hole, that is the pilot hole I have to make when I place a mini dental implant. So I'm not making any incisions or stitches. I essentially make this little pilot hole, and this shows too how much, you know, I don't have to have a lot of bone to place the mini dental implant. I just have to have some bone to place the mini dental implant. So you can just see the difference in how it is a smaller diameter implant.
Yeah, it's so small I can't even look at the monitor in front of me. I have to look at the monitor over here just to actually see where that hole is.
Yes.
But these are the end results. The other models that you brought here today, these are what the result of those mini implants are. You've got 3 different kinds.
Yeah, so I'm going to start with a snap-in denture because it's one of the most common things I do. It's a very affordable. I had a patient come in yesterday, actually got an outrageous quote for a snap-in denture, and we were able to give her a much more affordable solution. So the snap-in denture, so these are the mini dental implants. Like I previously said, I will numb you out local anesthetic. You can drive yourself to the appointment and drive yourself home. No incisions or stitches. The same day that I put these implants in, I will put these attachments inside your denture. So the same day I put the implants in, you will leave now with the denture snapped on to the implants. So no more denture glue, no more floppy denture. You can eat, we call it a denture stabilization, because now you can eat with that denture and you've got that confidence to know that your denture is not going to move and flop or fall out when you're eating. So it snaps in. You're going to take it out once a day, rinse and clean everything, and then snap it right back in. And then sometimes a lot of people, if they have, you know, good bone on the top, like this is a top denture, for the upper, sometimes I can trim the roof of the mouth off that denture and help with taste, so you can start tasting food again, or that gag reflex. I've had a lot of patients come to me, can't wear their upper denture because of gagging. I'm able to secure their denture with the mini dental implants and then be able to trim some of that back so they can tolerate the denture.
And you have the permanent option of that as well, but I want to get to that second because we've got some examples of the permanent one. Yep. But even just individual teeth real briefly.
Certainly. So a lot of people are missing, you know, a back tooth, you know, the molars, so that they can have something more to chew with, or maybe you know, had a sports accident or a car accident and you're missing a front tooth. I can replace a single tooth with the mini dental implant. And when I place the mini dental implant, the same day I put it in, you get a temporary, you get rid of that flipper partial, and you don't have to wait 3, 6 months to a year to get your final tooth. You're going to come back 4 to 5 weeks later, and I'll have the nice, pretty permanent crown that gets cemented on permanently. And so nothing comes in and out of your mouth anymore. You no longer have a partial or a flipper and you're, going to brush it just like regular teeth. It gets cemented on permanently.
And so we've got a couple minutes left here. You've got a permanent option here as well, and we have some examples that you can show right after.
Yeah, Gary will show you examples, but this is just the permanent option. We're just going to use more implants, but then we make a new set of teeth out of a much stronger material, so it gets cemented on permanently, but then you have nothing on the roof of your mouth. You get to taste all your food. You're going to brush it just like regular teeth. It's the closest thing to getting your teeth back.
So who we got here?
Yeah, so this is Miss Kim, and she has the permanent teeth on the top and a snap-in denture on the bottom. This was exactly what I was talking about. She came to me, had all her teeth removed, could not tolerate dentures. She wasn't wearing anything. She just gave up on it. And we were able to do the mini dental implants, give her permanent teeth on the top and a snap-in denture on the bottom, and now she can smile again and have that confidence and go out, now she's definitely more social, going out to eat again, and just has that confidence.
It's got to be so rewarding seeing them with that smile at the end. We got one more here.
Yeah, and this is Carl, saying that he was missing some teeth, knew his teeth needed to come out, didn't want to spend any more money trying to save them. So we did the permanent teeth on him. He's got the permanent teeth on the top and the bottom. So that is so secure in his mouth. He brushes those every day just like regular teeth. He doesn't have to take anything in and out. He can taste all his food. He can basically eat whatever he wants. As long as it's good for natural teeth, it's good for these.
Yeah, exactly. And they can visit you and they can get a free consultation. And very important, if this is something you think you may be interested in, make sure you're giving them a call. Dr. Ackerman will take care of you. 502-937-4930. You see the website there as well, Freedom Mini Implants, or Freedom Implants. .com. Dr. Ackerman, appreciate you joining us today on Listens Live.
Thank you.
We got more Listens Live coming up after the break. We'll see you in just a couple minutes.